So good morning, King Drew staff, students, parents, and community members. It is my pleasure to serve as Magnet Coordinator for King Drew Magnet High School of Medicine and Science, where I have the opportunity to share amazing information about our exceptional programs and community partnerships. Today, our goal is to join together in a discussion about how we can help others, protect our community, support the most vulnerable, and ensure a safe and quicker return to school and normalcy. We have special guests that will lead our discussion. We have an amazing team assembled here for you today, but first I'd like to introduce the King Drew Careers team. We have Ms. Cooper, Ms. Soto, Ms. Moore White, and an amazing translation done by Ms. Campos as soon as that's enabled. And most importantly, we have our team from MLK, the Outpatient Center. I'll let you guys introduce yourself. Dr. Aman, the floor is yours.
Hello, good morning, everybody. Hopefully all is well. It's a pleasure to meet all of you virtually. My name is Dr. Yasser Rahman. I'm from your neighbor across the street, as well with the guest speakers with MLK Outpatient Center. And so we are very, very proud to kind of join in this effort. But just so you know that we are, a healthcare provider that have had long relationships with the high school on the volunteering side, but more importantly, we are also available for even just primary care needs and so forth. So we'll just provide later information in the chat. But it is a pleasure to meet all of you and I'm excited.
Hi, I'm Dr. Tasha Dixon. I'm the lead for family medicine here as one of your neighbors across the street, and I provide primary care services. And I'm happy to be here with you guys to talk a little bit more about how the vaccine can help us to move forward towards a new normal.
Good morning, I'm Jasmine Eugenio. I'm a pediatrician. I'm also the Associate Medical Director of Martin Luther King Outpatient Center. I have been in this community for 25 years. We are your neighbors, and I love working with the Magnet School and serving this community. We are so proud to be here today.
Thank you. So we're back. We have interpretation. I'm going to ask you, Ms. Soto, to repeat one more time for our guests to make sure they can join.
Buenos días. Si necesitan la información en español, pueden ver abajo de su pantalla un botón, un círculo que dice interpretación. Opriman eso para que puedan escuchar la información. Todo en español. Gracias.
Okay, thank you. And without further ado, Drs. Dixon and Eugenio.
So we're just going to get this set up. It'll take us 1 second. Can everyone see the screen? Awesome. I see those thumbs up. I love those thumbs up. So we're going to do, this is going to be super interactive, right? So I love the thumbs up. We can see some of you guys. We also love the chat feature. So if you've got questions throughout this, whatever it is that you want to know, that's what Dr. Eugenio and I are here for. So please use that chat feature. Please, I see the hands raised as well. So we'll be able to go through those questions as well. All right, so we'll get started. So we're here to talk today about myths and facts around the COVID-19 vaccine and why it's important for every single one of us to either get the vaccine or to tell someone else about getting the vaccine if we've already been vaccinated. So we're going to start with a poll. It's a question we just want you to put in the chat. You can answer in your own leisure, but how likely are you to vaccinate your child and your family? So 1 for highly unlikely, 2 for unsure, 3 for not likely. I made it easy, so you just have to put a number and hit enter. And we're going to keep talking. So for some background information, there are currently 3 vaccines, and we'll talk a little bit more about how these vaccines were produced in a little while. So we've got Pfizer, we've got Moderna, and those are mRNA vaccines, and they require 2 vaccines, either 3 to 4 weeks apart, depending on which vaccine. And then the other vaccine that's currently approved in the United States to use is the Johnson & Johnson vaccine, which is made slightly different. For our pediatric patients right now, the only vaccine that's currently available is the Pfizer vaccine. It has been studied and approved for ages 12 to 17. Studies are ongoing for our younger children, but it is perfect right now for those at the Drew Magnet, for everyone to be able to get their vaccine. It is the same one that's given to adults. It's the same one that I also received about 6 months ago. And it's given the same way that it's given for adults. The effects are similar, and it is now approved to be given at the same time as other vaccines.
I just want to piggyback on that, Dr. Dixon. And the news this morning, they're saying that Pfizer is almost finished with the vaccine for 12 below, and we may expect to see it in the fall.
Exciting news for all of us on the call, on the meeting, sorry. We wanted to really get to the why. This is so important. And so it's coronavirus. It's what we've been through for the last year, and it's what we're hoping to move past in 2021. And so taking a look at the end of May, in the time that we have had this pandemic, 1,244,000 individuals have been confirmed with having COVID-19. We had 24,000 deaths. And right now, at the end of May, only 54% of residents were at least partially vaccinated. So we've got our work to do. We also would be remiss if we did not address hesitancy in our community. We are fully aware, as an African American, I am fully aware of what we as a people have been through, especially in terms of coming forward to Juneteenth in the next few weeks. I had some hesitancy myself in terms of getting the vaccine, especially in terms of political climate, and making decisions. And I chose to get the vaccine. I chose to trust science. But I made that decision for myself after knowing the information and some of the information that we're going to review with you guys today. In terms of the other studies, so the Guatemalan, there have been several cultures that have had reasons to mistrust science. And I saw this quote: people aren't mistrusting of the medical system. The medical system has actually violated the trust. And so as someone who is an African-American and as a doctor, I am here to tell you that we want to regain your trust and to earn your trust as a community. And so we're hoping that through forums like this, that you're able to ask your questions, so that you'll know that we're here to serve you. We're here to be a trusted partner with you as well. In terms of by race, you can see that people of color are at the lower end of getting vaccinated. So Latinos and African Americans are about neck and neck in terms of getting vaccinated. And that's the actual community that we serve and that we're in here. And so that's another reason why we're really here to have this conversation, this open and honest conversation with you today.
So today we're actually here to address any myths and talk about the facts in terms of what these myths are. One of the things that I've heard quite often is people say that if I've already had the vaccine, that it's too soon to know if the vaccine is effective. And that's the myth. And the fact is, all vaccines were thoroughly tested and studied to meet safety and effectiveness requirements. Studies found that the two initial vaccines, which is Pfizer and Moderna, are about 95% effective and reported no serious or life-threatening side effects. Because COVID-19 was so contagious and widespread, it didn't take long to see if the vaccine worked for the study volunteers who were actually vaccinated. Another myth: researchers rushed the development of the COVID-19 vaccine, so its effectiveness and safety cannot be trusted. A fact is, the COVID-19 vaccine was created with a methodology that has been around and developed in the past years, so that it was easy to start the vaccine and develop the process during the pandemic. There are many reasons why the COVID-19 vaccine developed so quickly, and here's just a few. The COVID-19 vaccine from Pfizer and Moderna were created with a method that has been developed for years, so the companies could start the vaccine development process early in the pandemic. For example, China isolated and shared genetic information about COVID-19 promptly
so the scientists could start working on the vaccine. The vaccine developers didn't skip any testing steps, but conducted some of the steps on an overlapping schedule so that we can get the data faster. The vaccine projects had plenty of resources from the governments who invested in the research and have paid for vaccines in advance. Now, some of the types of COVID-19 vaccines were created, and remember this, using messenger RNA, which allows a faster approach than the traditional way that vaccines are made. Social media has also helped companies find and engage lots of volunteers, thousands of them, who were willing to help with COVID-19 vaccine research. Companies began making the vaccines early in the process, even before the FDA authorization. So as soon as they said it was okay, some supplies were already available. Now,
So we just put a diagram to kind of show, what we were just talking about. So traditional development, we have phase 1, which takes about 2 years, phase 2, which takes 2 years, and phase 3, which takes 2 to 3 years. But as Dr. Eugenio was saying, there was just simple overlap in each of these processes, but no steps were skipped, no phases, and production started during the phases. So we just wanted to show it kind of in document in picture form for you to better understand.
now, this is one of the things I hear a lot among parents and children. They say that the COVID vaccine can give you COVID. Some of the vaccines given, none of the vaccines give anyone the virus because none of the vaccines contain part of the virus. There's not enough information currently available to say how long people are protected from COVID-19 after they've got sick from it. Early evidence suggests, though, that natural immunity from COVID-19, it doesn't last very long, so more studies are needed. However, some scientists believe that the vaccine offers better protection than the coronavirus natural infection. Now, the mRNA technology is new, that's a myth, and changes your DNA. And I'm going to talk about it in a few minutes. The mRNA technology is not new to scientists and medicine. It has been used and studied for almost 20 years. Now, let me talk a little bit about how the vaccine was developed. To understand how the vaccine was developed and how it works, though, you must first understand how your immune system works. Developing a vaccine takes a long process, usually about 8 years, as Dr. Dixon said, because a lot of things have to be vetted. Now, we all know that the COVID vaccine was developed in less than a year. And in the past year, we were able to develop mRNA vaccines, which take a shorter period of time. And I'll talk to you about how this happened. But before that, let's talk about the immune system. How does it work? Let's start from the very beginning. You're all familiar with the COVID virus, this little devil over here with the red spikes. And the other part is your cell right here. That's you. So when the COVID virus enters your system, what does it do? It attaches with its spike into your cell. The virus attaches to your cell with those little spikes jutting out from its body. When it does that, it injects its RNA right here, which is like a blueprint for your cell and gives instructions on your cell on what to do. So it's going to go in there and boss your cell around, which is not what we wanted to do. So when it injects the DNA here, what happens? With the DNA inside it, it tells in the RNA inside you, it tells the cell to make copies of the virus. Like here. So this is your cell. Now there's more than one. It's creating a lot of viruses. And what happens is your cell becomes like a factory with a virus assembly line and produces more viruses that infect more cells. That's what happens. But then don't worry. Our bodies are the defense system called immune system for any foreign invaders. This immune system will attack any proteins, viruses, or bacteria that don't belong in our bodies. Unfortunately, see the immune system is thinking, it takes them a while before they develop a strategy. And sometimes days go by and you start having symptoms like fever in this case. And so as the immune system is thinking about its strategy, the virus keeps multiplying in our bodies. And so what happens then, after a while, the immune system has an aha moment here, like, aha, I've developed a strategy. I know what to do. I know who these invaders are. And it starts to attack with those ninja antibodies here, those spikes, throws it at the viruses and destroys it like this. All right. And so the immune system can kill any intruder. It kills the viruses and the bacteria and any proteins that come in. Unfortunately, it is slow to attack. So, hence the vaccine. The vaccine is developed to give the immune system a helping hand. And that's why the vaccines have been developed. The main idea is we're training the immune system to recognize and fight off the infection before it has occurred. It's like, showing the immune system a mug shot of the virus. Now let's talk about how the virus works. And now how the vaccine works. Remember those spikes on that coronavirus? And remember the two vaccines that are mRNA are Pfizer and Moderna. Now, the spikes, we said, allow the virus to attack the cells and infect them. So here's the main idea with the COVID vaccine. What if we train our immune system to recognize the spikes by having our own body produce them? To do this, the scientists took the blueprint, remember the blueprint of the RNA, and isolated the part that only produces the spike. So armed by the blueprint, they created an mRNA. This is the RNA that enters your cell and gives it instructions to build spikes, not the virus itself, just the spikes. That's what happens when you have the vaccine. So the mRNA vaccine contains instructions, so almost, like giving the cell a recipe that will tell your cells to build part of a virus, the spike. So it produces large amounts of spike. And once this happens, what happens? The immune system comes in, it's triggered, and it's looking at it, what are these spikes? And of course, it's thinking of a strategy, but eventually, of course, develops a strategy and kills the intruders. Even the mRNA, so this is now the immune system killing the spikes, and it also kills the mRNA that's in the cell. That is why you don't get sick, because you had, what you were given was only the spike, not the virus itself. So all that's left in your body is this guy here, the memory cell. These cells can stay around for months to years or until the same virus here infects you again. And when this happens, the B cell is all ready. There's no strategy needed. We just attack, kill that virus that's coming to your body. This technology has been around. It's easy to develop. And as long as we have the sequence of the mRNA or DNA, we can make the vaccine. The Pfizer and Moderna vaccine are mRNA vaccines. And this is what they do. They enhance the immune system. It does not interfere with our DNA. The mRNA never enters the nucleus of your cell, which is where our genetic material is kept. The vaccine utilizes technology that is new but not unknown. So the mRNA vaccines have been studied for influenza, Ebola, rabies, and cytomegalovirus.
Okay, so after that awesome cartoon and understanding, we want to get back to our next myth. So I don't need to wear a mask after I get the vaccine. The fact of the matter is that vaccinated people still carry and spread the virus to unvaccinated people. And so that's where we want to get into the next myth. If I had COVID, I don't need the vaccine. Natural immunity can protect you, but it's not long-term. And so it is possible to get infected again. Vaccines, though, appear to protect people even longer. So when you see that strong guy, when you see that little memory cell, those memory cells are still sitting around waiting for the virus to come back. With that cheat book, we say, aha, you're not going to get us this time. And so the vaccine is still important, even for those that have been even those that have been infected. And this gets to herd immunity. So we've all seen on TV, herd immunity, herd immunity, herd immunity. What is herd immunity? And I'm glad that someone asked that question, but I didn't see it in the chat. So herd immunity is the idea that if more of us get vaccinated, then the disease does not spread as far. So the whole community stays safe. And so thinking about what we want to do for our school and in this neighborhood, we urge all of us to get vaccinated so that we can get closer to this herd immunity. So you see on the left hand, if only a few people are vaccinated, then one person that's infected can spread the disease super fast, right? But if a lot of people are vaccinated, you end up on this right side where the whole community can stay safe. And what this means is that you feel safer going to the movie theater, you feel safer going to the grocery store, you feel safer starting to go back to the parks. So the question is, how long will it take for us to get to this herd immunity, or this idea where our community is safe? Without the vaccine, it would take us 59 months to get closer to herd immunity, and that'd be 2025. Who wants to wait that long to get to herd immunity? I know I don't. The time to get to herd immunity with 25% of the population or our community getting vaccinated is 30 months. With half of us, which is about where we are, is 10 months. But just imagine if 80% of our community got vaccinated by the end of this month, by the end of June, we would reach herd immunity. And so it's not just those that have already been vaccinated, but it's telling our family and friends and those now 12 to 17 at the high school, it's time to get that vaccine. So the next myth that we want to talk about is that the vaccine causes infertility in women.
So the vaccine, they're saying that vaccine causes infertility in women. And the fact is the vaccine does not interact with women's reproductive system or cells. There are no reports or evidence to support this. The COVID-19 vaccine will not affect fertility. The truth is that the COVID-19 vaccine encourages the body to create copies of the spike protein that I showed you that's found on the coronavirus surface. This teaches the immune system to fight the virus. The confusion came about when there was a false report on social media that the spike protein on this coronavirus was the same as another spike protein called syncytin-1 that's involved in growth and attachment of the placenta during pregnancy. The false report said that getting the COVID-19 vaccine would cause a woman's body to fight this different spike protein and affect her fertility. Now, the two spike proteins are completely different and distinct, and getting the COVID-19 will not affect the fertility of women. Now, however, if you do not get the COVID vaccine, you can have potentially serious impacts on pregnancy and the mother's health.
So the next myth, the side effects of the COVID-19 vaccine are dangerous. The fact is that the COVID-19 vaccine can have some side effects, but most of them are short term, not serious or dangerous. And although some people may experience some pain, these symptoms, may only last a day or two. Some of the symptoms the side effects that you may notice are being a little bit more tired than normal, pain or swelling at the injection site, or what you see in this shoulder right here called COVID arm. That's still something very, very common. I could imagine would be extremely frightening if I saw it on my child at home, or if I had it myself, I would say, no, I'm never getting the other vaccine. But this is quite common. Fever or chills for a few days and headaches. In most of these cases, the discomfort is normal and should go away, but when to call your doctor is if the symptoms are lasting more than 3 or 4 days, or if something just feels a little off. We're always here for reassurance or for evaluation as needed. There was another myth that the vaccine contained controversial substances, and the fact is that the first two vaccines contain mRNA, normal ingredients from vaccines, which is some fats, some salts, and some sugars. So we just broke it down a little bit for you to be able to see that, for fats, we think, the fat on our skin, but it's really fats that serve as a shipping container to protect the mRNA. So it packages it really nicely, kind of like the bubble wrap, to make sure that it safely gets to its destination. And then the salts, the sugars, and the other compounds, they're just there to help to provide support and extra cushioning. There is no metal in the virus, in the vaccine, so you're not going to be attracted to magnets. I've heard that before. Fetal cells were not used in it. The Vatican has said that it is safe to give. It is morally acceptable to give for religious purposes as well. So there are some considerations of when of getting the vaccine. So like we've already said, if you've been infected, yes, still get the vaccine, but please, we recommend waiting until you recover from your acute illness. So within the first few weeks, when you're really feeling ill, don't get the vaccine then, come in maybe a month afterwards. But we recommend if you did get extra treatment for your COVID, like monoclonal antibodies or convalescent plasma, we still do ask that you do wait the 3 months or 90 days before getting your vaccine. If you have allergies, it is not a complete contraindication to getting the vaccine. Please talk with your doctor. We typically monitor for 30 minutes. If you've had an allergic reaction to eggs or to other vaccinations, we will still give it and just monitor you for a little while longer. For everyone else, 15 minutes is the normal observation time. In terms of other vaccines, like we said earlier, it is now possible to get that vaccine with other vaccines. So when it comes time for flu shot in the fall, you'll be able to get both of them at the same time. If it's time for your shingles vaccine for our kiddos, for some of those booster shots or tetanus shots, it is still possible to get both of those in the same day. So parents, you don't have to bring them back now twice to separate out the vaccines. For those that are immunosuppressed, it is still possible to get the vaccine. You still can get it, but we do recommend talking with your specialty team and your care team before getting it. In terms of women that are pregnant, you still can choose to get vaccinated. I do recommend having an honest conversation with your care team. Pregnant women are at an increased risk of severe illness, like Dr. Eugenio was just mentioning. And so the vaccine has been proven safe in pregnant women, but actually getting COVID-19 can have some very serious implications. And so something for us to all consider, as well as with once our pregnant women have had their babies and breastfeeding moms can still choose to get vaccinated. The antibodies are safely passed to the newborns in breast milk. So you do provide a little protection to your babies. And for a pediatrician and a family medicine doc, both sitting here, we both recommend breastfeeding. Yeah. Please breastfeed. It is liquid gold. It is healthy for your babies. You'll save money on formula. So don't hesitate to breastfeed.
And you don't have to wash any bottles.
You don't have to wash bottles either. And it's great bonding time for both you and the baby. So in summary, some reasons to vaccinate. It's safe. The side effects are usually mild, but you get that immunity. The serious side effects are rare. The vaccine can prevent you from serious illnesses from COVID. They will keep us safe. They will keep our loved ones safe. They will get us back to doing the fun things that we wanted to do that we missed out on last summer, celebrating 4th of July at Rose Bowl or going wherever for your festivities. It will get us back into schools to be able to hang out with our friends and play our sports and cheerleading, and businesses will be able to reopen. So the breaking news, and we're coming up on 6/15 for California to have additional reopenings. For those that are completely vaccinated, you don't need to wear a mask outside. You can visit without a mask, those that are vaccinated. You can visit those that are not vaccinated safely with some caveats, but those that are still not vaccinated still need to wear their masks. So another reason to get that shot. I know that I'm tired of having to wear this everywhere and I forget it in the car, but this will go away. The more of us that get vaccinated and we get closer to the herd immunity, the better. Last question, where to get your vaccine? So this Saturday, we will be having our Saturday event for vaccine clinic. So you are welcome to come on over right across the street and get your vaccine here. No need to make an appointment. You'll see my smiling face on that day, here to welcome and cheer you on as well. You can always go on to our public health website to find other locations of where to get vaccinated and how to get vaccinated. But at the end of the day, if you have a question, your neighbors are here to get you a vaccine 5 days a week and some Saturdays. Another place, still public health, you can also call 211 to get a vaccine to find sites as well. That's it for us. Thank you for taking the time out to listen to our presentation. And we definitely are here for any questions. And if you want to tell us now how likely you are after hearing our conversation, please feel free to put that in the chat, or we're also monitoring the question and answer as well. Thank you. Thank you.
Thank you so much. That was very informative, and I really enjoyed the graphics that explain things very clearly. So thank you. Up next, Ms. Moore-White. All right. So I think I have Emily. Are you on here?
Yep, I'm here.
All right. You want to introduce? We're going to play the video of your PSAs.
Oh yeah, great. So my camera's gonna be off. My internet isn't the best right now. So I don't wanna be breaking up. But hi, my name is Emily. I'm a senior ambassador for the class of 2021. And I'm a student at King Drew. Just kind of a summary. I got vaccinated recently, I think.
Oh, I'm sorry. You're just going to intro the video.
Oh, my bad. Well, these are the senior ambassadors who also wanted to explain to you why they got vaccinated and where and like how and their symptoms, and just to explain to you that it's not that bad as people say.
Hi, my name is Emily Del Real. I'm a senior ambassador, and I got the vaccine because I wanted to be able to see my family and friends and still be able to go out and keep everybody protected. So after getting both doses of the Pfizer vaccine, I didn't feel a lot of symptoms. The only symptoms I really felt was maybe like a small headache, and my arm was aching. But other than that, I felt great. There wasn't anything that was hurting or anything that was like ultimately painful about it.
Hi, my name is Nina Borden, and I am a senior ambassador. I got vaccinated because I believe that my health is important and that I should take it serious. Also, I want to help prevent the spread of the virus so that no one else gets sick from it or die.
Hi, my name is Jocelyn Garcia, and I'm a senior ambassador at King Drew. I got vaccinated because not only is it a requirement for the UC system for me to be able to go to college and live on campus, but I wanted to be able to protect my friends and family. After getting both doses of the Pfizer vaccine, I did feel very sleepy and tired and took about 5 naps during the day, but overall, my symptoms were not bad.
Hi, my name is Diamond Tilbert, and I am a senior ambassador. I got vaccinated because my mom was told to get vaccinated by her doctor, and they also told her to get me vaccinated because it would be in her favor to do so since she is high risk.
So, hello everyone, my name is Reggie Brookins. I'm a senior ambassador at King Drew Magnet High School of Medicine and Science. My parents were kind of just like, okay, things are opening back up. You're traveling, you have siblings at home, you have grandparents at home, like maybe you should get your vaccine just so you can be a little bit safer when traveling to these places and going to play against these people who you don't know who they've been around. They could have something, and then I risk bringing it back to my family. After getting the vaccine, I did kind of feel a sense of relief, knowing that I would be a little bit more safer traveling to these places. And then, of course, I did have some symptoms, but they were nothing different than what the CDC said my symptoms would be. Like my arm was a little bit sore, and after my second vaccine, I was a little bit drowsy. But other than that, I was fine, and I was actually really relieved.
Hi, my name is Blair Adams, and I'm a senior ambassador. I plan on taking the COVID vaccine because I know that it can help to create a safer environment for those around me. Ultimately, I know that it can help keep my family, friends, loved ones, neighborhood, community, and school safe.
So make sure to get vaccinated, guys.
Awesome. Thank you, ambassadors. I'm so proud of them. They have been an amazing contribution. And they're graduating, so we celebrate them and we thank you for that. And then up next, we have your questions. Any questions that you have? I'm sorry, I want to introduce quickly Dr. Rogers, who I think joined our call. He is a doctor I met when I went to get my daughter vaccinated. Actually, I think maybe he had to go. Okay. But he came on to say hello. He's also from Charles Drew University. So, but we have time now for questions, anything that wasn't addressed or anything you want to share. Well, we have a class with no questions. It just means that the information was very thorough. But we do want to share the vaccination event that is on Saturday. So as they mentioned, you don't need an appointment. It begins at 8 a.m. It goes to 1, and you have 2 options for your second dose. So I'm going to also ask that we drop the link to this whole resource. So we'll give you the link to this flyer, as well as the $50 incentive that the state of California is offering, which is on the next slide. And if you qualify for that, then you can apply and add that to another good reason to get vaccinated. Okay. So we have a Q&A with no questions, but I would invite anyone to add some last thoughts or contributions.
I just want to say that that video was absolutely outstanding. And kudos to you guys. So young, I never would have thought about putting together a video to fight, you know, so passionately for someone to get the vaccine. I would love to share that with others. So if there is an opportunity, I happen to be on the committee for communications for COVID for the county. And so that I think every teen needs to hear, every child and family needs to hear. And so I would love to be able to share that. But kudos to you guys for putting that together, for editing it, for everything in that. I am impressed, so impressed. Y'all can come and work with me when you graduate.
Well, actually, we have a program where we work with you while they're in high school. So yep, that's a great opportunity. And the video actually is produced on our YouTube channel, Katie Vision. So I'm happy to drop the link actually in the chat for everyone if Ms. Moore-White could help with that. And let's definitely talk about taking this to the full community. That's why we're here. And we're so happy to have you professionals take your time to help create this environment and discussion for everyone. So thank you for being here. Thank you for offering this, your time and our hope for coming back and feeling safe.